Hello again, everybody. This is our second video on our YouTube channel. Welcome. I'm Selvin Nanikin, an optometrist at Precision Vision in Pikesville, Maryland. So as you can see on this picture, you can see that the eye is really irritated. You can also see that it's very red, and this has to be a painful eye. And this usually is what a dry eye presents in our clinic. Dry eye syndrome is a very common problem that we see as optometrists and is associated with many other things besides just contact lenses. Most people think that when contact lens wearers have dry eyes and nobody else seems to have the problem, but dry eye is a very common inflammatory condition, and it's seen on contact lens wearers and non-contact lens wearers. As you know, we talked about common vision problems in our first video, and that had to do with nearsightedness, farsightedness, astigmatism, and presbyopia. Now, dry eye syndrome can also cause blurry vision because of all the irritation. As you can imagine, the surface on this eye is very irritated, so a patient not only complains about discomfort, they also complain about blurry vision. So why is dry eye a problem? Because the tear layer, which consists of 3 distinct layers, as you can see in the slide, it has a mucus layer, it has a watery layer, and it has an oily layer. And those 3 layers work together to form a tear layer. And when one of those layers is not functioning well, or if it's missing, then you have what's known as an evaporative problem or a dry eye problem, and we'll discuss that in a little bit more detail. But the bottom line is the tear layer, when it's irregular or if it's inadequate, you have a dry eye problem, which in turn causes the eye to look like this. So what are some of the symptoms that are part of the dry eyes? The common symptoms that we see in our clinic are itchy eyes, redness, burning sensation, foreign body sensation, meaning like something's in the eye. They also talk about grittiness, like a gritty feeling when they wake up or when they blink, painful eyes, and watery eyes. It's counterintuitive to think that dry eyes are watery eyes, and the reason for the watering of the eyes is when one of the tear layer is missing, the water layer tries to make up for it by producing more water, and therefore there's a lot of tearing in dry eyes. So a teary eye does not mean it's not a dry eye, it means it's probably a secondary effect of the dry eye. So what do we look for in clinic when you come in complaining about dry eyes? We look at your gland function, which is this here, the lacrimal gland, which is located on the upper eyelid. We also look at some of the structure here in the drainage canal called the puncta to see if the drainage is happening properly. We look at the eyelids because the margin of the eyelids have glands that produce the oil layer of the tears. And we also look at the general eye, the whiteness of the eye, and the blood vessels to see if there's any kind of inflammation or any sort of dilation of the blood vessels. So some of the common causes of dry eyes are listed here, but what you have to look at is what causes the dry eyes. Is it because the tear layer is deficient, meaning the aqueous is deficient, or if it's evaporative, meaning the tears are evaporating too fast? And the aqueous deficient problem is more of a concern in non-contact lens wearers because it happens regardless of whether you wear contacts or not. Whereas the evaporative problem is more prevalent in contact lens wearers because the eyes generally can't keep up with the loss of tear layer to the contact lenses. And we don't want to get into detail here, but just understand that the dryness has to be differentiated for the treatment to be initiated. And that's important because the treatment modality and the effectiveness of the treatment is only achieved by differentiating what exactly the dryness is being caused by. So generally we classify the dryness as mild, moderate, or severe. And as you can see, a mildly dry eye doesn't really have a lot of staining. We actually use what's known as a fluorescein stain to see what kind of irritation that the eyes are presenting us with. And basically, you can see these little irritated eyes are all these dark green spots on the slide. The more staining that you see, the more severe the dryness is. So here we have a mild eye, mildly dry eye, a moderately dry eye, and a severely dry eye. And the most common way to treat moderate to mild dry eyes are just lubricating drops. And sometimes we use a combination of prescription drops to reduce the dryness and the inflammation. As I told you, we have to differentiate what the dryness is from, and your optometrist will tailor the treatment based on the etiology of the dry eye. Some of the most commonly available drops that you can get over the counter are Cystane, Theratears, and a whole bunch of these here. You can get them at any pharmacy. And these are all preserved drops. And this here is an ointment, which is kind of thick that you can use at night. This particular one here, the Refresh with the 100 vials, is preservative-free. So for the more severe dry eye patients, we even eliminate the preservatives. So we recommend that they use the preservative-free eye drops in conjunction with the pharmaceutical therapy. We also can use punctal plugs, and essentially we take a plug that looks like this, and we insert it into the drainage canals. You basically have 4 drainage canals in the corner of your eyelids, 2 below and 2 up top by your nose, and that's where the tears drain through the nasolacrimal duct. And what you can do is you could actually use a plug to plug it up to reduce the drainage rate, so you can allow the tears to stay in longer. And oftentimes, because we have some problems with gland function, which essentially produce the oil part of the tears, we need to unclog these glands not only with ointment and eye drops that are prescription, we also have to use a warm compress. So oftentimes your optometrist will tell you to use a warm compress, and basically you take a hot warm washcloth, or in this case it's actually made for the eyes. You just place it on your eyes and leave that on as long as you can. And there are some more advanced therapies that are available based on the severity of the dryness, but these are some of the basic therapies that we try first. We try to use some eye drops that are over the counter, along with some pharmaceutical prescription drops. We try to use punctal plugs to reduce the drainage rate. We try to use warm compress to improve tear quality, and then if that doesn't work, then we go to more advanced therapies, and your optometrist will tailor you the therapy and talk to you more about that based on the patient's problem. So our address is 4000 Old Court Road, Suite 204. We're located in Pikesville, Maryland, 21208. Our website is www.ultimateeyewearmd.com. And our phone number is 410-653-2400. Please give us a call or email us with questions. Thank you.